It's also coincidence that this paper was withdrawn because in January of 2020, uncanny similarity of unique inserts in 2019 nCoV spike protein to HIV-1. And it's published by Cold Spring Harbor Labs. These are the bringers of eugenics to Hitler for World War II to happen. Cold Spring Harbor, Rockefellers, all the old time eugenics population control people, they sponsor research into genetics and such things. This paper was printed. It's still out there. Talks about the ACE2 receptor. There's 4 unique inserts. These were the claims. It was withdrawn, of course, right? Too early in the pandemic. Look at that. That would prevent so much horror later throughout 2020 if information like this were not suppressed. Luc Montagnier's comments were not suppressed. But
hydroxychloroquine was not suppressed. I mean, we could go on and on and
yeah,
on. Gary Mullis, his issues with the PCR test at high cycle thresholds, not suppressed.
Right. Well, and we are going to go on and on because I'm about to do this deep dive. We talked a couple weeks ago about the Project Veritas leak from Major Joseph Murphy from the U.S. Marine Corps. He's a DARPA fellow. He's an intellectual working at DARPA with access to many resources. And we had kind of gone over his letter, and I found his letter to have some interesting language. So I made a note for later to go ahead and read the source material that he used before he formulated his opinion and wrote it down in this letter to the Inspector General regarding the Wuhan Institute of Virology, EcoHealth Alliance, and the origins of the SARS-CoV-2 pandemic and the spike protein and the investigations therein. So what I did was I went back to the August 2021 dump of documents from, what was it? Project DRASTIC. Got these DARPA documents. This is a EcoHealth,
some sort of
Alliance.
Like research, some nebulous research group on Twitter and other forums.
Yeah. This is DARPA has a project called Preempt. So the Defense Advanced Research Projects Agency Preempt project. This is to keep pandemics from breaking out. And this lead organization, EcoHealth Alliance, they make this project DEFUSE. This is their application for grant under DARPA's Preempt, saying they want to do these things. EcoHealth is saying, we want to come play with you. And this involves Duke University, University of North Carolina, Ralph Barrick, Wuhan Institute of Virology, Dr. Shi Zhengli or Zhengli Shi, U.S. Wildlife, World Wildlife Foundation friends there, and a couple other groups. And here you clearly see Peter Daszak, EcoHealth Alliance on the cover page. This is from 2018, kids. All right. This is before the thing happened. And what happens in this document takes a long time. We're going to have to do like a whole video breakdown, but this is a real piece of evidence. And if you analyze this evidence page by page, as I have done, you can read through. I don't have time right now in this episode at 2:30 in the morning to go through all 70 pages with you. But what I can do is say,
I did cover the beginning of it, but I didn't see the later sections that you highlighted. Like this we covered, but I didn't go.
Yeah. So what I can say is all these source documents we have organized into a folder that even if you're not a Grand Theft World listener, you can access the links and the notes for this episode and download these documents, read them for yourselves. What I found were at least 4 smoking guns in here that lead back to NIH, CIA, MI6, EcoHealth Alliance, Ralph Barrick, Shi Zhengli, Tony Fauci, and a whole bunch of other people who wanted to do gain of function, spike protein, chimeras to get it to attach to human ACE2 receptors, which heretofore bat coronaviruses wouldn't do before they did gain of function. And what I'd like to do is be able to scan in this entire document with my notes and highlighting and make that a download as well. But I know that savvy people could just screen capture as I'm flipping through and talking right now, and you'd at least have an idea of why you might want to look at the nanoparticles and the aerosolization and the batified mice and the vampire bats. Okay. mRNA gene therapy discussions. You know, it's all right there for people who want to read it. Like I said, we should do a deep dive video on its own
That's
and do this
fascinating.
in
I'm
depth,
looking at some of you.
right?
I only covered the beginning of it to prove the point that DARPA was interested in this type of project.
Yes.
The main point I made 3 weeks ago.
They asked for it.
Yeah, they asked for it. They said it's
They wanted it.
selectable. The key language there, they said it is selectable, but they have some concerns.
P3CO.
They wanted this.
Remember Fauci saying, "Oh, it's not gain of function, it's P3CO." Right?
All right.
This is the origin of that claim. They're creating a chimeric novel coronavirus
The
right here.
recombination, which means they're using
ACE2.
multiple different inserts of various other viruses.
I
and
mean,
they're letting it go.
This
through.
isn't even a foreign language. It's in
Natural
perfect
selection.
English. You can understand a chimeric virus that attaches to the human ACE2 receptor
because they can't get these bats, that bat virus through.
because it doesn't happen in nature, Tony.
Right.
That's why they
right.
got to use 76 pages to describe how they can use their lab to do this. There's the bat, there's the people. They even put it in pictures. So if you're like a fan of Schoolhouse Rock, you could get this.
Let's not forget about the Moderna patent that the NIH had access to. That ran out in 2019. They needed a pandemic to come forward, and Moderna needed a miracle. Hail Mary, according to Whitney Webb, if I remember correctly.
They got Barrick here. We will use novel chimeric polyvalent recombinant proteins in microparticle encapsulated gels for oral delivery and or virus adjuvenated immune boosting strategies where chimeric recombinant SARS-CoV-S are expressed by raccoon pox virus at our test cave in Yunnan.
So it's any sort of respiratory virus, any sort of coronavirus that causes.
This was the page, by the way, it talks about reducing the spillover risk because they're really good at that.
Yeah.
They also talk about
everything's
because they knew antibodies, the monoclonal antibodies would work.
Yep.
So they worked on negating its effects in this concoction that they did, right? They come up with novel nanoparticle delivery systems, aerosol release, chimeric immunogens, more nanoparticles, aerodynamic encapsulated into our aerodynamic MPs and nanoparticles. Viral infection models were built.
That was in Duke University where they
nanoparticles through the skin, right? That's transdermal, where they enhance the immune response in mice to SARS-CoV spike proteins, and it's transcutaneous. That's the nanoparticles through the skin. That's where I'm getting that from. That's what transcutaneous means. More aerosol delivery on page 21. And by the time you get to page 22, aerosol spray delivery. And then they had this glycerin gel transfer. Now this is interesting because they said the bats, they put the stuff in the gel and through grooming activity from preliminary data, initial trials led to them understanding that through their grooming, the bats would spread it amongst themselves. Well, what's hand sanitizer? Doesn't it have glycerin in it? You got all these human beings. So if you replace bats in this plan with human beings, you pretty much have what they did.
Yep. Well, it also sort of portends to what would come with the mRNA vaccine, the lipid nanoparticle. It's the delivery for the RNA itself, which I'll get into right after you finish because there's an interesting stat news article going back.
Here's
to 2016.
Daszak, subcontract USAID. That to me means CIA and MI6.
Correct.
Right? 3 types of BSL labs. Wuhan Institute of Virology. They had a Wuhan Institute of Virology includes BSL2, BSL3, and BSL4 laboratories, animal feeding rooms, and other supporting facilities. And if you go to the page before this, it has like a who's who of the suspects. Daszak, Barrick, Zhengli Shi, right?
Yep.
These are the people who investigated and said there's nothing to see here. It came from a wet market, everybody. Here's Daszak with NAIAID. This is Fauci working with Daszak. More Daszak USAID grants.
Yep.
So they were showing their bona fides to get this grant. Here's smoking gun number 4. Let me just get into so you get that on screen. They wanted to do experimental assays of the SARS-CoV-2 for the jump potential, conduct in vitro testing of chimeric viruses against host cell lines, assess in vivo pathogenesis in ACE2 transgenic mice, validate results for chimeric viruses with full genome at UNC, test synthetic modifications, that's gain of function, to viral spike proteins, proteolytic
including
cleavage,
RBD deletions, receptor
cleavage
binding.
sites. Isn't that how they like attach
Yeah.
the HIV to it?
Yep.
These are really, I mean, and then when you get to this one, they got the batified mice. You see that? The bat mice model. They call it earlier in this document, it's humanized mice, and they also have batified mice, right? They were trying to make a vaccine for the bats.
Pox virus
This is
vectored immune boosting. Hold on, chimeric SARS-CoV-2 spike immunogens, and pox virus vectored immune boosting molecules available for use. Proof of concept for targeted immune boosting, which is that would probably be on an adenovirus, which is what the J&J and AstraZeneca vaccines ultimately end up.
And what does deliverables mean? That's what they turn in at the end of it, right? A chimeric SARS-CoV-2 immunogens and pox virus vectored immune boosting molecules available for use.
Yeah.
Proof of concept for targeted immune boosting approach in humanized mice and captive bats.
Which, because of Sherry Markson's work, we know there's video of the mice and the bats in the Wuhan Institute laboratory. We had the moratorium in 2017 being lifted in 2017, I should say.
Task 3, develop and assess delivery systems to deploy immune boosting molecules. Right? They got all these transcutaneous and nano delivery aerosols.
Yep.
Aerosolization mechanism. Here we go. DARPA. This is just page 30. So it goes on for another.
What's disturbing is if you can think about it like this. What's disturbing about the aerosolization is if you can create a nanoparticle, it's surrounded by a lipid that can survive even for a couple of minutes.
Could you use PEG or TEG, polyethylene glycol or triethylene glycol, and make some sort of lipid nanoparticle like envelope to hold the thing, Tony? Could you do that? And if so, what type of toxicity might PEG or TEG have on the immune system of people who take that in without informed consent?
There's like commercial grade used in like textile industry and paints and stuff like that, and then there's food grade that's used. So you have to distinguish between the two. At low volumes, it wouldn't necessarily have a problem, but it could. I mean, that's the thing. Like, it all depends. I mean, one of the big problems with, and let me just read this, because that actually is a perfect segue here to the little.
When you said it all depends, I thought maybe this is the Joe Biden show and that was the sponsor.
And again, shout out to Senna. She provided me for this because I did not find this. Ego, ambition, and turmoil inside one of biotech's most secretive startups. This is Stefan Bonsell, who recently this week nuked his Twitter account and sold off $10 million worth of shares that he had associated with Moderna. Now, he's been selling off millions of dollars worth of shares over the past couple of years, from my understanding.
Now, Moderna is the one that has the mRNA universal vaccine for HIV in the works, right?
Correct. And there are the ones that also, I mean, mode RNA. They were one.
They used to be a cancer therapy, but then they turned into the COVID thing.
Correct. And that's where
mRNA comes in, gene therapy.
Yeah. So this also, if you want, if people are interested in the history of this, A Leap Towards Humanity's Destruction is the name of the article by Whitney Webb. This was published on June 25th, 2021. She gets into the Welcome Trust and Welcome Leap. There's Regina Dugan. Very interesting history. And so she gets into
Regina.
I know she says Regina, but come on. So she talks about Moderna. Let's see, is this the one with the Hail Mary? Maybe that's another article, but she talks about Moderna needs a Hail Mary. So she has a couple of articles in regards to Moderna and their involvement. And this one wasn't that one, but it still has a lot of good information in it. Nonetheless, we go back here. I type in nano. Okay, this is back in 2016. This is what they're saying here. The choice to prioritize vaccines, let me just take away this, came as a disappointment to many in the company, according to a former manager. The plan had been to radically disrupt the biotech industry, the manager said. So, quote, why would you start with a clinical program that has very limited upsides and lots of competition, end quote. The answer could be the challenge of ensuring drug safety, outsiders said. Delivery. and this goes to what you're just saying, Rich, delivery, actually getting RNA into cells has long been bedeviled, or has long bedeviled the whole field. On their own, RNA molecules have a hard time reaching their targets. They work better if they're wrapped in a delivery mechanism, such as nanoparticles made of lipids. But those nanoparticles can lead to dangerous side effects, especially if a patient has to take repeated doses over months or years. Novartis abandoned the related realm of RNA interference over concerns about toxicity, as did Merck and Roche. Now, here's the problem with that. One of the big things that Malone has been talking about is the nanolipid particle structure with the luciferase enzyme. When they witnessed it inside mice, it would go to the ovaries, it'd go to the heart. The ovaries are the big one, the reproductive, the ovaries and the gonads, essentially the reproductive organs of the mice. It would go there and it would cause a whole host of potential interactions. So when he's been talking about the lipid nanoparticle structure, it's not just the spike. People focus too much on the spike, which is a serious problem. That alone is probably what's causing the heart inflammation situations. But the nanolipid particles, where it ends up in the body, circulating in the body, is also by itself a very, very problematic situation and causing a lot of. So it's not just the spike; it's the nanolipid particles. There's also the fact that what's her name?
And for anyone who's
Christina
like,
Catherine Christina.
Yeah, anyone that might be skeptical of that, just go to NCBI. You type in mRNA nanoparticle aerosol, and you can read all about it. There's 2,000 results, y'all.
Now, actually, going back to this article, interestingly, quote, now as we're going to human trials, it's pretty clear no one else is going to catch us, end quote. This was Kenneth Chine, scientist who works with Moderna. Moderna's most advanced competitors, CureVac and BioNTech, which is the division that Pfizer markets and creates the vaccine. That's why it's called BioNTech.
It's like the relationship between Rockefeller and IG Farben.
Yeah, that's great. That's a great analogy.
Pfizer and BioNTech.
Yes. The Nazis. So they have acknowledged the same challenge with mRNA. This goes back to 2016. Each is principally focused on vaccines for infectious disease and cancer, which the companies believe can be attacked with just a few doses of mRNA. And each has already tested its technology on hundreds of patients. So supposedly they already tested this stuff going back to 2016. It acknowledged that these problems exist. Let's see, quote, I would say that mRNA is better suited for diseases where treatment is short duration and sufficiently curative, so the toxicities caused by delivery materials are less likely to occur. So the point here, and this is from BioNTech.
mRNA.
I know, right? Or one of them, yeah. And
one of the patent holders of the technology.
And there were a couple individuals part of the Ron Johnson roundtable that also highlighted the fact that there are human genetic sequences beyond the HIV, which they also brought up. There's human genetic sequences also part of the mRNA technology that's not being acknowledged by Pfizer or Moderna. So there's the nanolipid particle structure that's essentially the payload, or encasing the payload, which would be the RNA sequence, the envelope.
It's like the Trojan
and then on
horse
top of that, you have
the
these genetic sequences that are getting into the cell's ribosomes. Now, what happens in the cell's ribosomes is that is where viruses replicate, in the ribosomes. Very strange. Like, all this whole thing is just, well, it's a
COVID's been a very educational experience for everybody.
Nightmare. So, and this goes back to 2016. They recognize these issues. Now, going back to 2012, we had some of those animal models and ADE, but we don't have to talk about that one. People,
again, if I found a rusted out Ford pickup in the woods, I would assume it came from a Ford manufacturer and not the squirrels and beavers and indigenous wildlife and zoological origins of the woods. That's it. This is a highly refined, mechanized, off-the-shelf BSL-4 creation of a multinational, supranational organization that exists and is slurping up everybody's everything for the past 2 years.
Correct. And just looking at some of the chat, yeah, I mean, one of the issues with synthetic DNA is that the reverse transcriptase can actually then permanently rewrite your cell's DNA once it goes through the reversing process and turns itself into DNA. And that's another concern that was brought up during the roundtable Ron Johnson had with a bunch of different doctors, virologists, epidemiologists, so forth and so on. So there's a lot of serious concern, and we're just in the beginning of this. Even if the mandates,
the fringe epidemiologists of Oxford, Harvard, and Stanford.
Yeah, Jay Bhattacharya and the other two I always forget, but yes, that's correct.
Fringe. That's
Fringe
just Francis
MD.
Collins ease for the guy's smart enough to catch us.
That's right.
Call them fringe, call them racist, call them white supremacists. What's the other one they like to use? I mean, institutionalized racism. Yeah, British Empire.
Systemic
Next question.
racism.
Systemic racism. I think that's still British Empire. What was the other one they like to throw around? Guess what the origin is going to be? Not the people been blamed for it. Like there are these things going on out there, but it's not people who are following the constitutional law of America, working hard, tilling their own land, not stealing from others, helping their neighbors. You know, it's not that ideal that is shaping the world. It's the ideal of Cecil Rhodes and other pragmatic people who think that truth and justice is what strong people say it is, instead of, you know, that being, which is uncontradictory with reality.
Yep, well said. And whether a toxin or virus, you know, always get these comments. The point is, you don't need the type of bioweapon that's going to kill millions of people. You just have to get people to march in lockstep to one solution. That solution, there is one universal solution. They didn't need the bioweapon to kill millions of millions. It actually could disrupt the elites in a way that they wouldn't want to be sort of put out, let's so to speak.
Yeah, I mean, you guys can
this is
argue
actually something Richard
viruses and
Fleming.
toxins all you want, but the people you're playing with have things on the shelf like Ebola Reston. You know that movie Outbreak where they almost had to nuke a town, like firebomb a town? That's based on the Ebola Reston virus. It's not Ebola Marburg. It's not naturally occurring. These are off the shelf Fort Detrick, you know, Porton down type of creations.
Right. And
they are real, horrific weapons of war, the likes of which the United States has not seen since mustard gas and chemical weapons of World War I trench warfare, also created by the same coterie of people whose legacy people in future generations, it's multi-generational game they're playing, are commandeering today. It's the same continuity.
No, you need to release something. That's the point I'm trying to, like, they're trying to say there's no, they
didn't create these things to create peace.
Yeah, that's correct. And they don't spend billions, arguably trillions, if you look at the totality of these investments in all these BSL-4 laboratories, not to produce something.
They make VX gas and other
call
things
it a
that like
toxin,
melt
a virus,
people.
something like. And I think Richard Fleming had the best. This might have been the most perfect bioweapon because it was just deadly enough to scare people, especially the Delta wave, but it wasn't bad enough to cause a sort of a complete breakdown of society and the logistics of society. So what it did was it got people to march in lockstep. Let's remember the Milken Institute in 2019. Patents run up. There's the Vaccine Modernization Act. They need to get this technology out there. Whitney Webb is talking about the Hail Mary that Moderna needs because they're going to go under. And BioNTech, by the way, was their division for mRNA research was also going under. So it wasn't just Moderna, it was also BioNTech. And there's a couple other companies that were researching this. They needed the miracle to happen. And sure as hell they got one.
Executive order September 2019 on vaccines that put in that task force, you know, and he's not someone I think who is informed on that. He just, you know, scribbles what he does so he can go play golf or whatever.
And even if you say
the people around him were cunning enough to, you know, get that through.
So that's wrong. It's been isolated many times. And one of the problems is there's narratives. If Fleming's work is incorrect, you could also say the people arguing against the isolation is incorrect. That's a very unfortunate misunderstanding.
If it was made on the computer in the first place.
Well, the bigger issue is people don't understand genetic science and bioinformatics, and there's an unfortunate narrative that's been promoted out there. And there's systematic debunkings that it's hard to find these because you're not finding them from the mainstream, but there's actual other virologists, geneticists that don't have a wide variety to get a large audience to get the information out there. But unfortunately, not only has it been isolated, microbiologists have been able to observe it. And on top of that, we have unique genetic structure on top of understanding all genetic structure of biological organisms, part of the phylogenetic tree. And it's distinguished from other viruses. So, I mean, there's systematic debunking
when they did this document. This is CRISPR, right? This is the end of January 2020.
I think, rather than CRISPR. CRISPR is a little different. Well, that might have been CRISPR, actually. You're right. I'm sorry. That's the HIV one.
right? Here's
Like the problem is like what happens is science has become so complex that it takes specialists to understand how these things work. But the way genetics works is like information. And so the way we do information transfer through computers is actually very similar to the way genetics works. So you only need a very specific small code of DNA that is truly unique to all the other biological organisms that exist. And I can get into the details of that maybe on the town hall. No, Thomas Cowan, Kaufman are not good examples of this. They repeat the same tired bromides, and they're very much incorrect about bioinformatics and genetics. So I've gone into this in detail in the past, and I've actually done podcasts on this. So I'm not going down that road.
You know, it's interesting in this paper here because it says these proteins are critical for viruses to identify and latch onto their host cells. So it seems like this HIV insert was necessary for them to get ACE2 receptor binding areas going. Anyway, it's withdrawn. I shouldn't look at it at all because I'm sure there's nothing fortuitous in a paper like this that is a snapshot of what was known very early in the pandemic before millions of people died without early treatment for 2 years.
Right.
And then recent inserts of HIV being recognized. Sure, there's nothing.
There's a reason, you know, we have to stop acting like these sciences aren't very well established and aren't sophisticated. I talked about the miracles of genetic science in regards when we show, what was that video, that movie, Gattaca, you know, when we talked about the individual that had essentially a engineered baby in order to save this other child's life. Like these technologies are very sophisticated, and so is genetic science. We should stop acting like it's not. So
like Gore Vidal. And
there's a reason why they spend billions of dollars
history
in this
teacher.
BSL-4 laboratories. Let me put it that way.
And Gattaca, where he's like, let me just portray Julian Huxley's wet dream of how the future works as a way of breaking that narrative before it formulates. Unfortunately, a lot of people saw Gattaca and were like, yeah, that's what we want. I'm like, oh man. Let's start the intermission with the Tim Dillon interview with Joe Rogan, talking about the people running the show, talking at a high level about the World Economic Forum, Klaus Schwab, and the coterie of 1,000 billion-dollar companies planning your life for collectivism in the future. Did that give you enough time, LD, to get to that clip?
It's in the intermission. Yeah, should be the second we have that.
Just roll that.
What makes the Grand Theft World podcast unique, invigorating, exciting, and informative? Most other podcasts out there are either doing straight up interviews or they're just covering the daily news. They're covering current events from the day they happened. And that is effective. It's useful. It's a great starting point. And then sometimes these current events change during the week past the first story. So we like to give it a little time. You have to wait till some of the dust settles on these stories in order to give them accurate coverage. And the other thing that's really missing in the media landscape is covering the articles that are coming out every day. That's great. That's necessary. But who's bringing in contextual history so that you can understand what has been going on for decades and decades to lead up to the machinations and actions that we see unfolding today? So what we do here on the podcast is we cover current events. Many of these things are censored, but we wait about a week. As a forensic historian, I focused mainly through my career on the history of globalism and collectivism and things that they call maybe the New World Order. There's a lot of facts to these sort of circumstances, groups, events, activities, working groups that they've had over time. So for Grand Theft World listeners, we not only break down the current events, most of which that are censored during the week, we provide you with contextual history, we give you the source notes, the references, we do deep dives, and this really empowers you with an understanding of context and history so that you can make more informed decisions in your life. There's also a community, a membership where you guys can actually ask questions. We can get into the show and share evidence. And there's a town hall weekly for Grand Theft World for those who listen to it and are interested in covering the stories that we don't get to during a 6-hour show. Listening to it an hour a day, you could easily consume the week's news, but you're going to have substance and meaning and context and understanding. And with that, you can make higher quality decisions in your life. So if you're interested in more quality in your life, go to grandtheftworld.com, click podcast at the top, and we'll see you there. Thank you.
These allegations are false.
This isn't Grand Theft Auto, folks. This isn't a video game.
What are the most surprising things that you discovered once you started pulling on that thread? Who he was connected to, what institutions he was influential over, what events he participated in?
Come on, man. What are we talking about? Come on, man. No.
You don't have to think about it, dude.
I got this quote because you said you didn't know much about Klaus Schwab. I made it my job to, as soon as this happened, I'm like, okay, this guy's their front man. Let me learn about the official history of the World Economic Forum. I got their 40-year history. I got every book that Klaus Schwab has written or ghostwritten. I went through those books. This is one of the most interesting passages.
Come on, man. Come on.